No, it was
No.
probably a 9 or a 10. Yeah, I'd
Okay.
say.
And that was constant 24/7?
Yes.
Every day. Was there anything that ever made it better or worse before you met me?
Yeah, it made it worse when I stood up and walked. No, it was
No.
probably a 9 or a 10. Yeah,
Okay.
I'd say.
And that was constant 24/7?
Yes.
Every day. Was there anything that ever made it better or worse before you met me?
Yeah, it made it worse when I stood up and walked.
The toes that were completely numb, now what is that?
Yeah, two of my toes on my left foot, my little toe, and the one next to it are their feeling is completely normal. So that's improving.
Yeah, so it's not a completely numb foot anymore.
Right.
And now after your first protocol, which I saw you back in April, this is June, during your first protocol now, after your first protocol, what did you tell me?
I'm probably at I could stand up all day long and work all day long right now. So I'm
blood pressure medication, so they gave you a diuretic. What was it
Exactly.
before? That brought it down. Now you've had 2 weeks. You just told me you had 2 weeks that you stopped taking the diuretic.
I quit taking the diuretic, and my blood pressure is virtually the same, 125 over 65.
Which
And
never happened before without the diuretic.
I had to have that diuretic.
15. Hi, I'm Dr. Herman here. Here's another great patient experience of what's happening with this unique care that I offer people, and I can help you too. And this is Mr. Erickson, a very nice person who's generous to share his improvements, his progress that he's experienced so far with my care. And although we're not reporting your complete recovery yet, but I think that we're grateful that he could share his progress already, so that you can see that there are steps that people can take to start improving their function. And in his case, it was neuropathy in your feet.
Correct. Yeah.
And how long was the neuropathy in the feet that you experienced before you came here?
About a year and a half.
And your first visit with me was
In April.
April. And a year and a half you had it up until April.
Right.
Okay, so now it's almost 2 years. It's
Yeah,
closer
closer
to
to 2 years.
We're
Yeah.
June of 2018 right now. You also, with the neuropathy, you also have high blood pressure.
I do.
How long have you've been taking blood pressure meds for how long?
No, 15, 18 years.
15 to 18 years. And they noticed how long ago that the blood pressure meds weren't working, so you had to get on a diuretic.
Shortly after I started on the lisinopril, they prescribed a diuretic, hydrochlorothiazide.
And that's what brought the blood pressure
Right,
down to a
right.
manageable, okay position. for
Yeah,
them.
yeah.
Okay. And back to the neuropathy for a minute. Your neuropathy was numbness?
Correct. Yes.
Numbness around the top and the bottom of both feet, or
Yeah.
just the bottom?
Just the bottoms of both feet.
Bottoms of both
Mhm.
feet. And the toes were numb?
Toes were numb.
Mhm.
Yeah, feet were numb. Balls of my feet, heels of my, everything.
Okay.
Yeah.
But nowhere in the legs?
No.
And nowhere in the hands?
No.
Okay. And the numbness in the feet on a 0 to 10, would you call it a complete numbness, or was there any sensation at all in there? Besides not the pain sensations, but
right,
was there any
right.
normal sensation at all?
No, it was
No.
probably a 9 or a 10. Yeah, I'd
Okay.
say.
And that was constant 24/7?
Yes.
Every day. Was there anything that ever made it better or worse before you met me?
Yeah, it made it worse when I stood up and walked.
You stood up and walked?
Yeah.
And immediately with the walking, or was it after?
After 15, 20 minutes, 30 minutes, I would have to sit down. I couldn't stand.
And you couldn't stand, not because of leg weakness, but because of the foot pain became
Exactly,
intense. And you
exactly.
called it was like gravel, you said.
Yeah,
you were
walking on
feeling
gravel.
Like
Yeah.
walking on gravel
Yeah.
barefoot.
Yeah, barefoot.
Yeah. But it wasn't like gravel when you first started to walk, but it became that after a few minutes on the feet.
Exactly.
And now after your first protocol, which I saw you back in April, this is June, during your first protocol now, after your first protocol, what did you tell me?
I'm probably at I could stand up all day long and work all day long right now. So but at the end of the day, it's painful again.
Mhm.
But so I'm probably about 80% there. I'm thinking.
80% improved. Because you can work all day. You used to have to get off your feet by 15, 20, 30 minutes because it
Exactly.
hurt too much.
Yeah,
But now you can walk
right.
around all day outside doing construction work,
Right.
and your feet are not killing you that way.
Yeah, I can work all day, and
not until
when I get home, I'm glad to sit down.
Yeah. But it used to stop you where you couldn't do the work.
I
So now
couldn't
you
have-
can
I
do the
could
work
have,
that you
yeah.
want to do.
I
But you
couldn't
couldn't
have
do it before
before.
because you couldn't stand up.
Exactly.
Yeah. And so we're improving. We're not there yet at 100%, but dramatic improvement, 80% that you could walk around now.
Yeah.
And also, You also said about 2 of the toes that were completely numb. Now what is that?
Yeah, 2 of my toes on my left foot, my little toe, and the one next to it are their feeling is completely normal. So that's improving.
Yeah, so it's not a completely numb foot anymore.
Right,
Not completely
right.
numb.
Not
Because 2 toes you
completely.
have feeling again, so they're not numb. So that's
Exactly,
great. Right.
yeah.
And you had been through, we're going to talk about the blood pressure in a minute, but you had been to, how many different doctors did you go throrough before you came here?
6 or 7.
And they
probably.
were neurologists?
Neurologists,
or GPs, or?
chiropractor. I even went to a urologist.
And what did these doctors do? They did MRIs?
They did an MRI, CAT scan. They did
nerve conduction?
nerve conduction test.
Did they ever come up with a real answer as to why?
They couldn't find anything. They didn't know why. They guessed, and once one offered to do surgery if I wanted to have a look at my back somewhere and poke around, but
you didn't,
I
you
didn't
didn't
do
choose that
that.
one. And they're also the. Did they offer you any therapies or pills or anything like that? And if they did you take any of those?
No, I didn't. I did some chiropractic work and just stuck with that for a few months. But
It didn't make a difference at all?
It had no effect at all.
Okay. And now again, we're 80% better with that. You can last all day working and walking. So it's not that painful like walking on gravel feeling when you're doing
Right.
work. And your feet, at least the 2 toes, are not numb anymore.
Right.
So their feet are still numb at this point, which will follow up with another video as he gets better and better with this unique work that I'm offering him and you. But also, one more thing. That's fair to say, yeah?
Right.
Okay.
Yeah.
So the other is that your blood pressure, they couldn't get your blood pressure down with the lisinopril blood pressure medication, so they gave you a diuretic. Well,
Exactly.
before that brought it down. Now you've had 2 weeks. You just told me you had 2 weeks that you stopped taking the diuretic.
I quit taking the diuretic, and my blood pressure is virtually the same, 125 over 65.
Which
And
never happened before without the diuretic.
I had to have that diuretic.
15 years ago.
Yeah.
And now we're 2 weeks without it, and your blood pressure is still
And
the same.
I'll be excited to get home and slap on my blood pressure machine and see where I'm at. But I think I'm pretty good.
You might be stressed by the blood pressure up by the kind of exam findings I showed you today. I told you about that. I don't know. But outside of that, we're moving along in the right direction.
Yeah,
That's fair to
absolutely.
say.
Yeah.
We're doing
I'm
good.
happy. I'm happy. I've done what I've done.
Excellent.
Yeah.
Thank
I'm happy
you.
you've done what you've done.
Thank you. Well, we're working together. You're the hero. I'm just helping you become the hero with it.
Yeah.
You're the one who's healing. You're the one who's given me the chance to do it with you and for you and help people see. So I'm grateful that you're helping me help people know. And I plan on getting you to the end of where you want to be, which is not the end of life, but you know what I mean, the end
I
of
know.
the disease and the whole thing going on, and having your life back so
Yeah.
you can function and enjoy it. You can call my clinic. I will put up information. I'll make another video with some exam findings that I did, that I found with him, that he found in his first protocol, followed in his first protocol, what he'll be following in the second protocol. But we're doing pretty good here, and better than anything anybody did for you in the past year and a half. And you can call my clinic. I'll make another video that'll show those findings here, then I'll merge with this video as well. And our phone number in the clinic that you can call to make an appointment is 954-370-3100. That's 954-370-3100. And you can also I'll leave the email address to my lovely assistant. She's very nice and happy to answer your questions and bring you in here. I'll put that down on the screen too, and look forward to helping you as well.